All right, today we're going to tackle the big issue of healthcare. And before we get to healthcare, we want to talk about an important economic principle that is found within healthcare. And that principle is asymmetric information. So this means when there is a difference in access to information between two individuals. So oftentimes we think about this as the buyer and the seller. If one has access to information the other doesn't, we would identify that as asymmetric information. So here is an example of asymmetric information. The examples are there's actually two consequences that come out of this. The first one is called moral hazard. All right, so moral hazard is when you go to rent a car and they ask if you would like insurance. And so you pay the 20 bucks and you get insurance, and now the car is completely covered for any dinks, dings, or other things that happen to the car. Therefore, as a result, because you have that insurance, you drive the car like this. That is moral hazard. So you as an individual are behaving in a way that is unknown to the rental car company. As a result, you might engage in more risky behavior. That is moral hazard. Now, if the rental car company had a camera on the car, you would not drive this way. The other consequence of asymmetric information is what we call adverse selection. So adverse selection is when the seller of a good knows more about the good than the buyer. And the example of this is always the used car market, that the person selling the car might know if the car is in good condition or is really a lemon, and the buyer doesn't know that. And so there can be issues that arise from adverse selection. And both of these are going to apply to the healthcare, and we're going to show exactly how in just a minute. When we look at the United States, we see a rising cost of healthcare. That over time, since the 1960s, the amount of the GDP, or the total money being spent in the economy dedicated to healthcare, went from under 6% to now it's almost 16%. It's right, this is since 2008, it's now risen almost to 20%. That means one in every $5 spent in the economy is on healthcare. It's not just that it's been rising in the United States, but it's been rising in the United States much faster than any other country. And so the United States is spending more as a percentage of their GDP on healthcare than any other country in the world. When we look at the cost to the individuals, the cost of the individuals are also rising dramatically, whether it be through deductibles or even premiums. These costs for healthcare are rising. So why are the costs of healthcare rising so rapidly? Well, there's several explanations to this. One is that the hospital cost is more expensive, that the treatments you get at the hospitals and at doctors' offices are much better, and as a result, much more expensive. We also have better and more expensive medical technology, right? Before, a doctor might just feel around to see if you broke a bone. Now you can do an x-ray, you can do an MRI. There's a lot of technology you can do that just becomes much more expensive. There's also waste, in the sense that many times doctors will prescribe something that just might be wasteful. And they do so for the notion of trying to do no harm and to try to do what's best for the patient's health and not necessarily for their budget. Also, Americans have a very unhealthy lifestyles. Obesity has been growing. It's plateaued off in the United States, but there's a lot of really unhealthy lifestyles, smoking being one of them, and other things that raise the cost of healthcare. And lastly is aging. Aging has really been a major change to the healthcare, is individuals are living longer in the United States. As a result, those last years of life are much more expensive, and they're requiring much more healthcare during those time periods. Furthermore, with the baby boomers, that generation born right after World War II, are now becoming older and older, and they are consuming more healthcare, which is raising the cost of healthcare in the United States. And so one way in which we address healthcare is through health insurance. And so here's an explanation of what health insurance is. So here's you. So you have an option where nothing might happen to you. 99 out of 100 times, nothing will happen. But there's that 1 out of 100 time that something bad will happen. Disaster strikes. And this disaster is incredibly expensive. So for scenarios like these, insurance plays a very important role, because there's these small probabilities of unlikely but very expensive events. And so what happens is you pay premium for an insurance. You purchase insurance. So 99 out of 100 times nothing happens. But when that disaster does strike, the insurance company pays for the expenses. As a result, you're able to insure against this risk, and it won't financially ruin you when it happens. And so the way that insurance works in this is that if 100 people buy insurance, if the risk of the event is 1 out of 100, then the insurance company can pay 100 times your premium. So that means if people are paying $5,000 worth of premiums, the insurance company now has $500,000 that they can pay out in the case of these unlikely events. And so if your event does cost you $450,000, the insurance company has enough money to be able to cover those costs. And so insurance works by having a lot of people pay in and having the insurance company then cover those costs of unlikely events. So some key terms are premiums, deductibles, and copay. Premiums are the monthly payments to purchase health insurance. Deductibles are oftentimes the amount you pay before insurance company begins to pay. So a high deductible plan might be that for the first $4,000 of any medical care costs you receive in a year, you pay that deductible, after which then the insurance company begins to pay. Also, many insurance plans have what are called copays. Every time you visit the doctor or consume healthcare, you pay a portion of the dollars, or oftentimes a $30 or $40 copay towards that visit. And so we talk about asymmetric information. The issue with moral hazard is that those with insurance might go to the doctor more often, might consume too much healthcare, or might engage in riskier behavior. And so there's an easy solution for this, and that is the deductible and copays. By having the deductible, if you go to the doctor too often, then you have to pay more money out of pocket. And so it's trying to disincentivize those individuals from going to the doctor too much. Copays are the same way. Every time you go to the doctor, you pay $40. For me personally, there's many times where I don't want to pay my $40 copay, so I actually won't go to the doctor for smaller things. The other issue is asymmetric information. That is, those that are most likely to use health insurance are those that purchase health insurance. Many young, early 20s, mid 20s year old individuals are very healthy and have a very low probability of actually getting sick. As a result, many of them might choose to not purchase insurance, and anytime they go to the doctor, they'll just pay in cash. This becomes problematic because then it's those that are most unhealthy who purchase health insurance, and that raises the cost of health insurance. And so the solution, we'll get to that in just a minute. So where do you get health insurance? Well, most people get their health insurance from their employer. And 48% of Americans do, so almost half of all Americans. This is really good in the sense that as a group, you are now insuring against that risk. The hard part with that is if you don't have a job, many times you have to find private insurance, or many times when you lose a job, you become uninsured. There's also a non-trivial portion. At this time, this is from 2014, 15% of Americans chose not to buy insurance for different reasons. Some may not have been able to afford insurance or qualify for insurance, or just chose not to. So there are challenges with our current healthcare system, and that is the healthcare costs are continuing to rise. There is still access to healthcare for those that are uninsured. If you're uninsured and you get into a car accident, they take you to the hospital will treat you. So there is access to healthcare for those without insurance, but as a result, this becomes very expensive. And if those individuals can't afford to pay for that care, then the hospital needs to share those costs with other individuals, typically with those that have insurance. How individuals consume healthcare is actually really problematic. A lot of people use the emergency room as their primary care physician, which is a very expensive way to do it. Doctors also prescribe healthcare. Many times doctors will prescribe procedures just to do exploratory or try to prevent lawsuits or other things, or try to do what's in best interest of your health but not your wallet. And so therefore, oftentimes doctors might overprescribe healthcare for their patients. With that as the backdrop, in March 2010, the United States government under President Obama passed what's called the Patient Protection and Affordable Care Act. We'll shorten this called the Affordable Care Act. Many individuals call this Obamacare. What the Affordable Care Act did is it regulated coverage of insurance companies. It determined that every insurance policy had to provide 10 specific items. It also said that you can't preclude someone from having insurance for having pre-existing conditions. It put limits on how much you can charge premiums, and it provided coverage for kids up to the age of 26. So now individuals who are 24, 25 can still be covered under their parents' health insurance. It also included an individual mandate, meant that everybody had to have health insurance, and if they didn't, they would pay a tax. It also set up health exchanges, a place to go for people to buy health insurance, and could also receive government subsidies to purchase that health insurance. So the question is, did it work? Well, there's two different outcomes we want to think about. Did it work with adverse selection, and did it work with moral hazard? When we talk about adverse selection, did it work with getting people on health insurance? And the answer there is unequivocally yes. That the Affordable Care Act, which the individual mandate took effect in 2013, we see a dramatic and immediate decline in the number of individuals in the United States that were insured or uninsured. So we see millions of people get access now to health insurance. And so that's supposed to drive down the costs for health insurance. So the question is, well, did it reduce the cost of health insurance? Did it address that moral hazard problem? And the answer is no. It did not have a very big impact there. So here the blue bars show what did the changes in healthcare look like prior to the Affordable Care Act. And you see that there were small increases for some, decreases for others. But after the Affordable Care Act, there was very large increases in insurance premiums, or the cost of insurance, for almost every age group. And so insurance became more expensive for most Americans as a result. Since the Affordable Care Act, when President Trump became president, he then made changes to the Affordable Care Act. So they got rid of the individual mandate, meant that there was no longer a penalty for not having insurance. One thing about the individual mandate is, like in car insurance, is you usually should pay insurance prior to having an accident. The individual mandate meant that everybody had to have insurance. So when the accident happened, or the unlikely event happened, you'd be covered with insurance, which meant that healthier people had to subsidize or pay the cost of unhealthy people. By not having the individual mandate, it could make it more costly for individuals, for healthcare for individuals. Federal government subsidies also provided subsidies, and so the subsidies continued, but they were reapportioned not to necessarily low-cost plans, but to more of these middle-cost plans, or what we call silver plans. It also increased access to skinny plans. So the ACA required certain essential benefits for each plan. A skinny plan could provide some benefits, but not all these benefits, and it was an option for 3 months under the Affordable Care Act. Under these changes under President Trump, these skinny term plans can be extended for up to a year and even renewed for more than 1 year. States can also add work requirements for Medicaid and change how the Medicaid funding happens. So there's been a lot of changes since the Affordable Care Act. But one question I really want to ask and think about is health insurance the answer? Does giving health insurance to Americans improve their health? There was one really great experiment done in Oregon called the Oregon Health Plan. And this randomly assigned individuals to different levels of health insurance. So some individuals were given free health insurance, and other individuals were given health insurance, but they had to pay for that. What we see is that the control group had to pay for health insurance. So their number of outpatient visits was about 1.91. Those in the treatment group had a significantly more number of outpatient visits. They had more prescriptions, and they had more ER visits. So what this shows is that by providing people free health insurance, they consumed more healthcare. This is the moral hazard problem. And this isn't so much a problem as long as their health improves. But what they found in this study is that those that reported health, they said, yes, my health improved, but all observable measures and metrics of health didn't show improved health. And so what this health insurance experiment showed is that individuals, when they have access to health insurance, consume more health insurance, but aren't necessarily any healthier. The other big challenge that we see today is that there are large variations in costs to healthcare. And there's a whole lot of reasons about this, whether it be HMOs, negotiations between insurance companies, or different ways. So for screening for a colonoscopy, which is a very unpleasant experience, I'm told, it could cost as little as $817 or as high as $10,000. And so there's very large changes in costs. And so if you don't know how to shop around for prices, it could be very expensive for you to go consume this healthcare. So here's just an example I actually experienced not too long ago here in Cedar City. So I can't say the name of this drug, but it's for cold sore medicine. And so you take 2 pills each time you get a cold sore coming on. And the question is, how much did it cost? And so when I went to buy it a couple years ago, it was like over $200. So I didn't buy it. I went to my doctor, and my doctor said, hey, let's go to goodrx.com and let's see what those prices are. So this is a snapshot of how much prices are here in Cedar City. So at my pharmacy at Walgreens, it was over $200 for the prescription. But you see here is at Walmart, it's normally $288. They've discounted it for this free coupon for $33. Costco is $49 typically. It's discounted to $20. At Smith's, it's normally $114. It's discounted to $19. So what this shows is that there's a large variation in retail price for the same exact generic drug. But there's also now this coupon you can use that reduces that cost dramatically. So I would not have purchased this medicine except for my doctor said, hey, look, you can buy it for under $20 at Smith's. And now that was something I was able to do. So there are large variation in cost to healthcare, even in a small city like Cedar City, and especially in larger cities. So the solution to healthcare coverage, that is your generation's challenge. This is not going away. And so we leave it to you for future generations of how are you going to address the healthcare challenge going forward. Best of success.